bit about today regarding how to calculate insulin dose in diabetes management, especially for those patients who are on insulin in their management protocol. That may be patients with type 1 diabetes or patients with type 2 diabetes. Maybe with the in type 2 diabetes, especially maybe with the insulins as well as the oral medications. Now, sometimes there is confusion regarding the insulin dose calculation and how to titrate it. Suppose a patient is on a basal insulin, long acting insulin, every day at the bedtime. So, in those cases, we know that basal insulin is specifically meant for the fasting sugar, the fasting blood glucose control. So, in those cases, what happens is whenever the patient is taking their fasting blood sugar in the morning, uh, uh, they say, and suppose the sugar came as low, so they start thinking that, okay, in that case, I should not take the morning tablets. But this is absolutely wrong. You have to remember the fasting sugar came as low means your previous night's basal insulin dose was heavy, high. So in those cases, from the next day onwards, that means that day only on the evening time when he's supposed to take the nighttime the insulin, from the next dose of insulin, the dose will be less, maybe 2 units less, 4 units less, 10% less, 20% less, whatever the doctor says. So this is the next example is suppose a patient is on a premix insulin, that is twice daily insulin before breakfast, before dinner. So patients are calculating sugar the morning time, after breakfast or after lunch or before dinner, after dinner and all. So if the after dinner sugar, so say for instance, if the after dinner blood sugar came as high, so that shows that the before dinner insulin which the patient has taken, that is inadequate. That means he or she needs more insulin. So in those cases, we can increase the insulin by 2 units, 4 units, or as per the doctor's advice. On the other hand, if the after dinner sugar came as low from the target which has been fixed, so in that case, that means the before dinner insulin dose needs to be lower. Otherwise, the sugar will fall further. So the crux of the message is whenever we are checking a blood sugar, be it in the fasting in the morning or after breakfast, before lunch, after lunch, before dinner, after dinner, whatever it may be. And depending on the blood sugar values, we are supposed to change the insulin dose of the preceding time. So we have to check the sugar and then we have to think in a retrospective manner that when the insulin dose to be modified. So if suppose a patient taken before breakfast one premix insulin, or say for instance a rapid acting insulin. So after breakfast, if the sugar comes as high, that means the before breakfast insulin was inadequate. So the dose needs to be increased. So from tomorrow onwards, we have to increase the dose. Say for instance, the before lunch or after lunch sugar came as low. That means if a patient having an insulin before lunch, that means we have to reduce the before lunch insulin dose. So we are checking after, but we are deciding on the dose of the insulin on the before the meal. So it is in a retrospective manner. Patients are, most of the patients, not all, most of the patients are thinking in a proactive manner, the prospective manner. That means my sugar came as low now, so I'm not supposed to take the next insulin. I'm not supposed to take the full dose of next insulin. I'm not supposed to take the oral tablets fixed for the next time. So it has to be thought in a retrospective manner. Now the sugar is high. That means my preceding insulin dose was low, so it needs to be increased. Now my sugar is low. That means my preceding insulin dose was high, so that needs to be lower. It's like this. It's very simple. If it can be followed, you don't even most of the times may not have to ask your doctor what should be the insulin dose in such a moment. And the complication arises for particular type 2 diabetes patients when they are on insulin as well as oral medication. So there lies a bit of confusion because the tablets might contain some group of medications which have a propensity, which have a tendency of lowering the blood sugar more frequently. So in those cases, you might need to ask your doctor, but in general, whenever you are checking the sugar, if it is low, the preceding insulin dose needs to be low. If it is high, the preceding insulin dose needs to be high. That's the simple take home message. Thank you very much.